Look at your hands right now. Turn them over, palms up, and just look. I have been a physician for many years, and I can tell you something most people never realize. Your hands are the most honest part of your body. They tell the truth long before your blood tests do. Have you noticed the jar lid feels harder to open lately? Do your fingertips sometimes go cold or numb, even in a warm room? Have your nails started showing ridges or your palms looking paler than they used to? Most people brush these signs off as just getting older. But here is what I want you to hear today. Your hands are not aging randomly. They are reporting. They are reporting on your circulation, your nerves, your blood sugar, your liver, your heart. And by the end of this video, I am going to share one specific morning habit, a simple 2-part daily ritual you can do at home using something already in your kitchen. That, when done consistently, addresses the deepest root of almost every hand warning sign I am about to describe. But you have to stay with me until the very end to hear it, because if I tell you now, the rest will not make sense. Let's begin. Why do your hands matter so much more after the age of 50? Because after 50, 3 quiet changes happen inside your body, and your hands are the first place they show up. Change number 1, capillary thinning, which simply means the tiniest blood vessels in your body become narrower and more fragile. Think of your circulation like the plumbing in an old house. The main pipes, your arteries, usually stay strong for a long time, but the smallest pipes, the ones in your fingertips, start to clog and shrink first. Research from the University of Cambridge found that capillary density in the hands can drop by up to 30% between age 50 and 70. That is why cold hands and slow-healing cuts become more common after 50. Change number 2, peripheral nerve slowdown, which is the gradual loss of speed in the nerves that run from your spine all the way to your fingertips. Imagine your nerves as electrical wires running through your house. After 50, the insulation around those wires, called the myelin sheath, which is just the fatty coating that helps signals travel fast, begins to thin out. Studies show nerve conduction velocity, meaning how fast signals travel, slows by about 10% per decade after 50. That is why tingling, numbness, and a clumsy grip start showing up. Change number 3, sarcopenia, which is the medical word for age-related muscle loss. In plain English, your muscles, including the small ones in your hands, start shrinking. Research from the Johns Hopkins School of Medicine shows adults can lose 3 to 8% of their muscle mass every decade after age 30, and the rate accelerates sharply after 50. Your hand muscles are tiny, so even a small loss shows up dramatically as weakness. Change number 4, micronutrient absorption decline, which means your stomach becomes less efficient at pulling vitamins and minerals out of the food you eat, particularly B12, iron, and magnesium. Your hands are unusually sensitive to all 3 of these, so when absorption drops, your hands speak up first. Now, here is the hopeful part. None of these changes are a death sentence. They are warnings, and warnings, when listened to, save lives. Your hands are giving you a head start that most people waste. We are not going to waste it today. Let's go through the 6 most important hand signals, one by one. A, the pattern. You go to open a jar of pickles, and you can't. You ask your spouse or your son to twist it open for you. You laugh it off. You say, "I'm just getting older." That moment is one of the most important warning signs your body will ever give you, and almost every person over 50 ignores it. B, the science and mechanism. A massive international study called the PURE study, led by researchers at McMaster University in Canada, followed nearly 140,000 adults across 17 countries. They measured one thing: grip strength. The results shocked the medical community. Each 5-kilogram decrease in grip strength, about 11 pounds, was linked to a 16% higher risk of dying from any cause. Grip strength predicted death better than blood pressure. Why does a hand muscle predict overall mortality, which is the medical term for the chance of dying from any cause? Because grip strength is a window into your total muscle reserve. When the small hand muscles weaken, it almost always reflects sarcopenia, that age-related muscle loss, happening throughout your entire body. Your heart is a muscle too. Your diaphragm is a muscle. Your back is a muscle. When the hand goes weak, the rest is usually following silently. C. The consequence. If grip weakness is ignored for years, the chain that follows is predictable. Falls, fractures, loss of independence, the inability to carry groceries, open doors, or push yourself up out of a chair. Worse, it correlates with higher rates of heart disease and earlier cognitive decline, which is just a fancy way of saying memory and thinking problems. D. The minor correction. You can begin reversing this today for free. Take a tennis ball, a rolled up sock, or even a soft rubber ball you have at home. Squeeze it for 5 seconds, release for 2, and repeat 10 times on each hand. Do this 3 times a day while sitting and watching television. Within 3 weeks, you will feel the difference. But understand this small exercise is only a piece of the puzzle. The full ritual I am saving for the end of this video is what makes this exercise actually heal the underlying cause. So please, keep listening. Now, if grip strength tells us about muscle, the next sign tells us about something deeper: your blood, your liver, and the oxygen-carrying ability of your entire body. A. The pattern. You stretch your fingers wide, and your palms look pale, or maybe slightly yellow. You assume it's the lighting in the bathroom. It rarely is. B. The science and mechanism. A study from Stanford University showed that examining palm color is one of the most reliable visual screens for anemia, which means a low level of red blood cells, or hemoglobin, the protein in your blood that carries oxygen. When the creases of your palm look as pale as the surrounding skin instead of pink or red, it is a strong sign your hemoglobin is below normal. Researchers found this visual check had over 70% accuracy compared to blood tests. If your palms are tinged yellow, that is a different signal entirely. It can point to bilirubin buildup, which is simply the orange-yellow waste your liver makes when it breaks down old red blood cells. When the liver is overwhelmed, that waste leaks into your skin. The palms and the whites of the eyes show it first. C. The consequence. Untreated anemia after 50 drains your energy, weakens your heart, and accelerates cognitive decline. The heart has to pump faster to compensate for the lack of oxygen. Year after year, that extra workload damages the heart muscle itself. And untreated liver stress is even more dangerous because the liver does not feel pain. It just gets quieter and quieter until it cannot keep up. D. The minor correction. Look at your palm creases in natural daylight tomorrow morning. Compare them to a young grandchild or someone in their 20s. If yours look much paler, do not panic, but do schedule a basic blood panel with your doctor. Eat 1 small handful of pumpkin seeds and 1 serving of dark leafy greens daily, both rich in iron and folate. But this small adjustment is just the surface. What I will reveal at the end of the video goes far deeper than diet alone. It works at the level of how your body actually absorbs what you eat. Color tells us about your blood. The next sign tells us about your nerves and the silent damage that often goes unnoticed for years. A. The pattern. You wake up at 3 in the morning with your hand asleep. You shake it out, blame the pillow, and forget about it. Then it happens again and again. Soon you start dropping coffee cups or feeling like your fingertips are wrapped in invisible gloves. B. The science and mechanism. This is called peripheral neuropathy, which simply means damage to the nerves that travel out to your hands and feet. Research from the Mayo Clinic shows that up to 50% of adults over 60 have some degree of peripheral neuropathy, and most do not know it. The 2 biggest causes after 50 are vitamin B12 deficiency and elevated blood sugar, even blood sugar that is just slightly above normal. B12 builds the protective coating around your nerves. Without enough of it, the wire frays. And here is what most people are never told. The medication that millions of people over 50 take for acid reflux can drop B12 absorption by up to 30% over time. This rarely fits into a standard 15-minute appointment. C, the consequence. Ignored neuropathy leads to a chain of frightening problems. You lose the ability to feel small injuries, so a tiny cut becomes a big infection. You lose grip precision, so falls become more common. In severe cases, the damage becomes permanent. The nerves do not regenerate well after a certain threshold, so early action matters enormously. D, the minor correction. Ask your doctor for a B12 blood test at your next visit, not the standard panel, a specific B12 level. In the meantime, add foods rich in B12 daily: eggs, sardines, plain yogurt, and grass-fed beef in moderation. But please understand, a higher B12 level on paper does not mean your nerves are healing. The real question is whether your body is using it where it needs to go. That is exactly what the morning ritual at the end of this video is designed to address, so stay with me. A, the pattern. You walk into a slightly cool room and your hands turn ice cold within minutes. Sometimes the tips of your fingers go white, then bluish, then bright red as they warm up. You think it's just being a cold person. It is more than that. B, the science and mechanism. A study published by the American Heart Association found that persistently cold hands can be an early sign of peripheral artery disease, or PAD, which is narrowing of the arteries in your limbs. When the arteries in your hands narrow, the heart cannot push enough warm blood to the fingertips. The body protects your core organs first and sacrifices the hands and feet. If the color changes happen in episodes, white, then blue, then red, that pattern is called Raynaud's phenomenon. It is the body overreacting to cold or stress, clamping down the smallest blood vessels. In adults over 50, new-onset Raynaud's is rarely harmless. It can be the first whisper of an autoimmune condition, which means your immune system mistakenly attacks your own tissues. C, the consequence. Long-term cold hands often signal that other arteries, including the ones feeding your heart and brain, are also narrowing. The hands are simply the easiest place to see it. If the warning is missed, the next sign of arterial disease is often a heart attack or stroke, not a cold finger. D, the minor correction. Run your hands under warm, not hot, water for 60 seconds, 3 times a day. This simple habit gently retrains your blood vessels to relax and open. Walk for at least 20 minutes a day, every day. Walking is one of the best free tools for arterial health that exists. But warm water and walking, by themselves, only address the symptom. The root cause, the inflammation inside the blood vessels, needs the specific habit I am revealing at the end. Hold on just a little longer. We've talked about color, strength, nerves, and circulation. Now let's talk about something most people never bother to look at, but it might be the most revealing of all. A, the pattern. You glance down at your nails while typing or holding a cup. You notice ridges running up and down, or a strange dip in the middle of the nail, or a pale color at the base and a darker color at the tip. You shrug, you buff them, you move on. Big mistake. B, the science and mechanism. Dermatologists at the Cleveland Clinic have long taught that nails are a slow-motion movie of your last 6 months of health. A fingernail takes about 6 months to grow from base to tip. Whatever your body went through during those 6 months gets recorded in the nail like rings on a tree. Vertical ridges can be a sign of dehydration or aging, usually mild. Horizontal ridges, called Bowes lines, signal a major systemic stress within the last few months, a serious illness, a surgery, or a nutritional deficiency. Spoon-shaped nails, called koilonychia, often point to iron deficiency anemia. A nail that is white at the base and dark at the tip, sometimes called half-and-half nails, can signal kidney stress. A study from the University of Pennsylvania found that nail abnormalities are present in up to 40% of people with chronic systemic disease, and most are unaware. C, the consequence. Ignoring nail signals means missing months of warning. By the time these conditions show up in standard blood work, the underlying problem is often well established. Your nails were trying to tell you long before. D. The minor correction. Once a week, sit in good light and look carefully at all 10 of your nails. Take a photo for comparison every month. If you see any of the patterns I described, Bow's lines, spoon shape, half and half coloring, bring those photos to your doctor. Eat 1 Brazil nut a day for selenium and trace minerals that nails crave. This is a step in the right direction. But the real game changer, the habit that nourishes nails, nerves, and circulation all at once, is what I am building toward in the final minutes. A. The pattern. You hold a glass of water and notice tiny ripples on the surface. You set down a spoon and your hand quivers slightly. You feel embarrassed and hide it. You attribute it to too much coffee, or stress, or just nerves. Sometimes it is. Sometimes it is not. B. The science and mechanism. Research from the National Institute of Neurological Disorders has identified several distinct causes of tremor in adults over 50. A tremor that happens when your hand is at rest, relaxed in your lap, is different from one that appears only when reaching for an object. Resting tremor can sometimes be linked to early changes in dopamine, which is a brain chemical that helps coordinate smooth movement. Tremors that happen during action are more often called essential tremor and can be related to genetics, thyroid imbalance, or low blood sugar episodes. A simple but underused observation. A tremor that worsens noticeably between meals often points to blood sugar swings, which are extremely common after 50 as insulin sensitivity drops. Insulin sensitivity, in plain English, is how well your cells respond to insulin and pull sugar out of your blood. When sensitivity falls, blood sugar roller coasters, and your hands shake on the way down. C. The consequence. Tremor is rarely the dangerous thing itself. What it represents, neurological strain, blood sugar instability, thyroid imbalance, is what causes harm long term. Untreated blood sugar swings damage nerves, blood vessels, the kidneys, and the eyes. D. The minor correction. Eat a small amount of protein with every meal. A boiled egg, a handful of nuts, a piece of fish. Protein steadies blood sugar far better than carbohydrates alone. If the tremor is new and persistent, see your doctor for a thyroid panel and a fasting glucose. This adjustment helps stabilize the surface. But the deeper rhythm, the daily ritual that gently retrains your blood sugar, your circulation, and your nervous system together, is what I am about to reveal. It's almost time. Now, step back with me for a moment. Look at all 6 warnings together. Weakening grip, pale or yellow palms, numbness, cold fingers, nail changes, and tremor. They look like 6 different problems. They are not. They are 6 branches of one tree. The roots of that tree are 4 things that quietly accelerate after 50. Inflammation inside small blood vessels. Insulin resistance, which is your cells slowly stopping to listen to insulin. Nutrient absorption decline, and oxidative stress, which is microscopic damage from unstable molecules in the body. When these 4 roots are not addressed, all 6 branches grow. That is why a person at 60 who ignores cold hands often ends up at 65 with neuropathy, and a person at 65 with neuropathy often ends up at 70 with heart disease. The chain reaction is real, but the chain is not unbreakable. Here is my engagement question for you today. Looking back, which one of these 6 warnings has shown up in your life, and how long did you ignore it? Tell me in the comments. I read every one personally. You stayed with me. Thank you. Now I am going to give you what I promised at the start. The one specific morning ritual that, in my clinical observation, addresses all 4 of those root causes at once. It is free, it takes 10 minutes, and it uses one ingredient already sitting in most kitchens. I call it the Morning Hand Protocol. It has 2 parts. Both are essential. Part 1. The warm cinnamon water. When you wake up tomorrow, before coffee, before food, do this. Boil 1 cup of water. Pour it into your favorite mug. Add half a teaspoon, not a heaping tablespoon, Just half a teaspoon of Ceylon cinnamon. Ceylon cinnamon, sometimes called true cinnamon, is gentler than the more common cassia variety. Stir it, let it sit for 3 minutes, then sip it slowly over 5 minutes. Why this works? A meta-analysis published in the Journal of Medicinal Food, reviewing multiple human trials, demonstrated that consistent daily cinnamon intake can lower fasting blood sugar by an average of around 24 milligrams per deciliter in people with elevated levels. It works by improving insulin sensitivity, helping your cells respond to insulin again. That single change touches almost every warning we discussed. It calms the small blood vessels. It supports steady nerve function. It reduces the inflammation that strangles capillaries. Part 2. The 5-minute hand circulation sequence. While you sip, do these movements with your hands. Movement 1. Open your hands wide, as if you are pushing against an invisible wall. Hold for 5 seconds, then make a tight fist for 5 seconds. Repeat 10 times. Movement 2. Touch each fingertip to your thumb, slowly, starting with the index finger, then middle, ring, and pinky. Do this on both hands, 10 rounds total. Movement 3. With one hand, gently massage the palm of the other in slow circles for 30 seconds, then switch hands. Movement 4. Squeeze a tennis ball or rolled sock for 5 seconds. Release for 2. Repeat 10 times per hand. Movement 5. Finally, place your hands under warm running water for 30 seconds while gently flexing your fingers. Why these specific movements? Research on hand exercises after 50 consistently demonstrates that combining grip work with fine motor movements stimulates capillary growth in the hands, improves nerve conduction, and increases the local blood flow that delivers nutrients to nail beds and small muscles. Studies on warm water immersion show it gently dilates the smallest blood vessels and lowers sympathetic nervous tone, which is the body's stress response. This entire 10-minute protocol does something no single supplement or pill can do. It addresses inflammation, blood sugar, circulation, and nerve function in one quiet morning ritual. Do this every single morning for 60 days before you change anything else. Most people who commit to this come back amazed. The grip returns, the hands warm up, the tingling fades. The body remembers. Here is your full action plan, simplified into clear steps. Look at your hands every morning in natural daylight. Compare your palm color, nail texture, and fingertip warmth across the weeks. Squeeze a tennis ball or rolled sock 3 times a day. Build the habit even before you feel results. Drink half a teaspoon of Ceylon cinnamon in warm water each morning. Make it your first sip of the day. Perform the 5-minute hand sequence while you sip. Treat it as a non-negotiable appointment with yourself. Walk 20 minutes daily, outdoors when possible. Movement is the most underrated medicine after 50. Add protein to every meal. A small portion is enough to steady blood sugar. Photograph your nails once a month. Bring the photos to your doctor if you see Bose lines or spoon shape. Schedule a B12 and basic blood panel this year. Do not skip it. None of this requires an expensive prescription. What it requires is consistency. I want to leave you with something I tell every patient who walks into my office worried about their hands. Your body is not betraying you. Your body is talking to you. The hands are the loudest voice it has. Listen early, and you can change the entire trajectory of the next 20 years of your life. Aging is not a life sentence. It is a conversation between you and your body, and you are finally learning the language. How old are you, and which point surprised you the most? Tell me in the comments. I read every single one. If this helped you, please subscribe so I can keep sharing the kind of guidance that rarely fits into its standard appointment. This video is for educational purposes only and does not constitute medical advice. Consult a healthcare professional before making any changes to your diet, exercise, or health routine.